just check one note while you're getting
go for
ready.
it. You're mic'd up and we're live now, so be careful. See.
Okay. I think we have 350s right now, right?
325.
325.
Yeah.
Okay, got it. All right. So everyone, we're live right now with our patient Jennifer, and today we're just going to talk about her plan. Her surgery's coming up in November, and she had a previous augmentation, and then she had capsular contracture, I think on the right side.
Yes, correct.
Not on the left side, right?
Just the right.
Okay, so in case you guys want to know, capsular contracture is when you have an implant and you can get scar tissue that forms around it. The main reason why she had this develop is because she had an implant above the muscle, and she also doesn't like how that looks, but that actually puts you at a 20% higher rate of getting capsular contracture with above the muscle placement. That's why majority of all my operations, I go partially underneath the muscle, right? So we get that muscle coverage, and that reduces the risk of that capsular contracture, and it also gives you a more natural look. There is a little more downtime to that because we are making some changes to the muscle. So I know that was a big factor for you. You didn't want the downtime the second time around. So now we're going to kind of do it right. We're actually going to do more of an advanced technique, because once you have an above the muscle pocket, we have to close that down and then create an under the muscle pocket. It's called a neo-submuscular pocket creation. But it gives a much better look, more natural look, and more sustainable look in terms of reducing the risk of that capsular contracture from coming back. So, okay. Now, do we have capsular contracture now or no?
No, we don't.
Okay, all right. So it was fixed, but now we want to go underneath the muscle, mainly for that improved appearance. Yeah. Okay. Good. I think we're a little backward right here. So
There we go.
there we go. Cool. You wanna? You can drop the blackouts, Danny, down just a little bit, about 3 feet, and that'll kill some of the light here too. Okay. So, what questions do you have?
I'm just
Yeah.
really excited.
Okay.
I feel like you guys have been so on point with answering all my questions when I first came here the first time.
Yeah.
So I'm just really confident, and I'm just beyond the moon about the surgery.
Okay. Love it. Me too. I'm excited for you. I mean, I think you look beautiful, you look great, but I know what your goals are, and we want to try and achieve that. So we like the size as well. We want to stick to 325. Is that correct?
I trust you because
Okay.
you know the look that I'm going for.
Right. Do we have that on? Do you have it on a photo at all?
It's I think
Okay.
I believe so.
Okay. Did you have some like inspiration photos?
Yeah.
You want me to look at?
Yeah,
Okay.
yeah.
All right. Cool. We'll take a look at that too. Make sure we're on the same page. But yes, I do know the look that you're trying to get.
Yeah.
More natural, and we talked
More
about
natural
it
for
last night,
sure, and
I
just
think
more
it's helpful.
proportion to my body,
Right.
obviously. So I found a couple photos from yours. So it's just like these
Mhm.
right here.
Yes. Beautiful.
Definitely more natural,
Mhm.
sitting right.
Okay.
Yeah.
Great. So we can definitely do that. I always, for those of you watching out there, I always kind of have people come and bring in your inspiration photos so we can kind of see if that's a realistic goal. I totally think that's realistic. So whether it's 325, 310, 335, we'll kind of dial it in, but we'll be in that range. Yeah. Anything change with your health otherwise?
No.
Okay. Good. All right. So I want to go over some supplements. Let's see, we have it? Okay, great. And this is, so for those of you who are thinking about getting surgery, and you can't come see me, but you can, okay, it's not LEX, there's flights here, all right, but if you can't, I created some supplements that I recommend all my patients take, okay, now for, and it's on my website, postoprecovery.com, you can check that out, but the main kind of game changer is the CBD, okay. This is something you want like after surgery or even before surgery. It helps with anxiety.
Okay.
It's no THC in it, so it's not going to get you high, unfortunately. So basically, you put a full dropper underneath your tongue when you get home after surgery, and it gets rid of the majority of the pain. It helps decrease inflammation. Yeah, because we are going to go underneath that muscle. You're going to feel that soreness. Okay, now the other thing that's kind of key is, I'm hoping there's magnesium in here. Yes, Calm. All right, this is the kind of the game changer in terms of magnesium. There's 7 different types of magnesium. Most of the magnesium, I don't know if you've ever seen on Amazon or in the drugstore, it's got like 1 or 2 magnesiums. They generally just cause diarrhea. Good for constipation, but other than that, they're not really getting absorbed in your system. So this gets absorbed in your system. Why that's important is we don't get enough magnesium in our environment anymore because our soils are all bad. They don't have the nutrients. And you get more muscle spasms, more muscle tightness and soreness. So for this surgery, it's like perfect. So take 2 of these right when you get home, and 2 like right before you go to bed. It helps with sleep, helps with anxiety, calmness, everything else. That's what we call calm.
Perfect.
All right, I'm excited for your thoughts on this.
Yes.
This is brand new. It's hot off the press. All right, the other products are, you want to start taking this one right now. This is before. This is our extensive organic supplement list that's going to help you get optimized for surgery. A lot of people feel like, oh, I want to take something after, and yes, that's important to optimize your nutrition afterwards, but it's actually leading up. So if you're going to run a marathon, have you ever run a marathon?
No.
Okay, you ever done a race? Yeah.
Yeah.
Okay.
I haven't.
Nothing. All right. Well, if you're ever going to do like a race or like a performance, right? You're going to practice. You're going to train, right? So it's like before is actually, in my opinion, better
So
for you to do.
prep you and everything.
Right.
Get you on
Versus
the right track.
versus after. This is our supplement after, and yes, and this is important. This actually has essential amino acids, so all the building blocks to kind of help you heal faster, so that you're back doing what you want to do as soon as you can, right? So we designed this whole thing for you to kind of have a speedy recovery. So
Thank you so
cool.
much.
Yeah.
Excited for that.
And this to you. All right. Great. Anything else you want to talk about? Share with people now we're live?
I think we covered a lot, and I'm just so excited.
Okay.
honestly.
What's one thing that is the biggest thing in your mind? Like, are you nervous about something, or what's the one thing?
I'm
that's
just
most-
really curious to see how the recovery is going to be this time around, just
Okay.
because the first two operations I've had is like over the muscle,
Yeah.
so the downtime, I'm just really curious to see how the downtime is, and as you know already, I do work out a lot, so I'm,
Yeah.
you know what I mean, like just taking that couple first weeks off, this first 6 weeks off obviously,
Mhm.
I'm kind of excited for that too, just to take a little break as
Okay,
well.
well, it's not going to be a full 6 weeks off. All right, so let me
Okay.
tell you exactly. So one good thing is that I inject a lot of numbing medicine in the muscle. So even though we are going to elevate the muscle, it's going to feel sore, I inject numbing medicine directly into it. So when you wake up from surgery, you're not going to have pain. And then we also have an option for 3 days for no pain. It's a longer acting one, which we can kind of work out for you to make sure that you can get that as well.
Oh, awesome.
So most of the time in that situation, you won't need any pain medication afterwards. So there's these little details. If your surgeon knows about them, can make a big difference for you in your surgery. Okay, so pre-injecting with numbing medicine, especially long-acting numbing medicine like Exparol, is a game changer. All right, so we can do that for you. The other thing is I like you moving right away. Movement helps you heal. Okay, our body have lymphatic systems. They don't have like a heart that's pumping lymphatics. They work on your body's movement. So moving around actually helps you heal. I might put you in a surgical bra after surgery, and then you want to take that bra off for like an hour a day to let the lymphatics kind of drain. Okay. Walking around right away. At week 1 for you can do leg workouts. So that's like isolated leg machines, okay, but not so much where you get your heart rate really up. It's not circuit training. Okay. 2 weeks you can do circuit training and get your heart rate up. And then it's 6 weeks for the upper body stuff.
Awesome.
Yeah. So I know that's probably a lot of what you do, but at least you can make it like one.
Yeah, no. I'm willing to sacrifice that for the perfect results.
Yeah.
Yeah.
It'll be live before you know it.
Yeah.
Okay. All right. Any questions from the audience?
The last question is, what is the price of some sort of surgery if you just want to let them know that Cliff is a call?
So, breast revision really depends, right? Because if she had capsule contracture, we actually had to remove that scar tissue and then start over. Pricing would be more increased. It depends on a lot of the time and the complexity. When it gets to, breast augmentation, our pricing ranges around $10,000 to $15,000. When it comes to breast revision, it can be higher than that. So it just really depends on it's a case-by-case basis for breast revision. But yes.
Virtual consultation.
Yes, but if you're interested to seeing how much something might cost, we do have virtual consultations. You can actually go to our website, drdanielbarrett.com, and click on our link for virtual consultation, send in some photos, and I actually get to review that and it could get back to you, all right? So check it out on drdanielbarrett.com.
And where can she find the post-op recovery product? Where can people find those products?
Go to postrecovery.com, and you can order the products there, postoprecovery.com. And then, how about you? How can people find you? Are you interested in sharing that?
Yes, so
Okay.
I am on Instagram. My Instagram is cooljen with 3 O's.
CoolJen with 3 O's.
Yes, so you can find me there, and I will be sharing all my journey throughout this whole process, so everything will be saved on my page as well, and then you guys can reference that back, and then we'll be sharing our content exclusively with each other.
So check it out, you guys. Start following CoolJen so you can see her journey, and we're going to take great care of her. Thanks for watching. Okay. Awesome. Cool. Thank you.
Cool, Jen.
Yes, absolutely.